Hello, my name is Dr. Fundile Nyathi, aka Dr. Fundi. I'm the Chief Executive and Chairman of Proactive Health Solutions, but in my previous life, I was a specialist family physician. And welcome to the HealthConnect Corner. Well, there's quite a number of things that I do to stay healthy. Firstly, my job is very stressful. But to try and have mental health, I try to rest as much as possible. I do have regular exercise because that way the happy hormones, they do help me to deal with the stress. But I could do better when it comes to, exercise. And the area where I am not doing very well, which I'm supposed to do, is healthy food choices. Because in the hectic day of my work, there's very little time to go and get proper healthy foods. So that's one area of my life that I could do better. But otherwise, regular exercise and doing things that reduce my stress levels, going to the salon for male grooming, being pampered, nails and grooming and scalp treatment and facials. I do all of those things, and also just connecting spiritually, by going to church, because all of those are just tools that one can use, to try and deal with some of the issues relating to stress. But definitely I can do better on exercise, and I could do better in my food choices. I think when it comes to red flags in the healthcare space, I think one thing that I really need to talk about is something that has to do with everyone now. When they've got a health challenge, they quickly go to Dr. Google. And the problem with that is that whilst you'll get information, sometimes the ability to analyze what you are getting from Dr. Google, not everybody has that ability. And so there is now a new thing of hypochondriacs, that are called cyber hypochondriacs. That is people who go to Dr. Google first, and when they read things there, they exhibit all the symptoms of what they read there. And they will then rock up at one surgery convinced that they have the problem that they read about. So the red flag for me is, as much as information is more accessible nowadays, but let's not take everything that we get from Dr. Google, as the gospel. Sometimes you need people who are professionals to help you unpack and see what applies to you and what doesn't apply to you. Well, I've mentioned that I am a chief executive of a health consulting company called Proactive Health Solutions. So what I enjoy most is actually the difference I make to the lives of the various people who work for my organization, who are interacting and impacting the lives of others on a daily basis. That I love. What I hate most is the problems that have to do with managing those employees, ending up at CCMA, having to defend nonsense. So that's one thing I don't like about my job. But I also like the fact that even though I'm in the corporate environment, I'm actually in touch with my primary profession of being a medical doctor. So that's why I do podcasts in the area of health. That's why I do radio. I'm a resident doctor on Weekend Breakfast on 702. That's why I also write on the leadership magazines a column called Health Matters. So I like sharing information with people. I don't see patients every day, but at least through those platforms, I'm able to empower others with the knowledge that I don't use every day.